The World Health Organization is facing growing criticism, not just from the US president. Has the WHO been handling the pandemic as well as it could, or have there been shortcomings? Before we address these questions, let's have a look at what the WHO is and what is within its remit. Health for all, that is the primary goal of the World Health Organization. 7,000 employees work for this specialized agency of the United Nations. The WHO provides guidelines on healthy living, for example, on the prevention of diabetes or the dangers of smoking. The organization also sets standards, such as in quality control for food or medicine, or with regards to water or air pollution. It promotes the development of health systems in developing countries and the production of vaccines. In the event of a crisis such as COVID-19, its role does not extend beyond assessing the global situation and giving recommendations. The WHO has an annual budget of around $2 billion. To compare, the United Nations Children's Fund spent 3 times that amount in 2018. Welcome to this edition of COVID-19 Special here on DW News. I'm Chris Goebel in Berlin. It's good to have you with us. Now, the number of global coronavirus infections has surged past the mark of 2 million. And fighting a pandemic in real time makes an accounting of potential missteps difficult. But as the outbreak progresses, there are people calling upon the World Health Organization to explain past actions in dealing with the coronavirus.
On December 31, 2019, Chinese authorities told the World Health Organization about a mysterious flu-like illness spreading in the city of Wuhan. 2 weeks later, the WHO published a tweet it would soon be haunted by. Preliminary investigations conducted by the Chinese authorities have found no clear evidence of human-to-human transmission of the novel coronavirus identified in Wuhan, China. The next day, a man flew from Wuhan to the US, becoming the country's first case. It would take another 2 weeks before the statement from the WHO.
I'm declaring a public health emergency of international concern over the global outbreak of novel coronavirus.
Cases around the world snowballed at an alarming rate, blowing past 2 million as of today. US President Donald Trump, under heavy criticism for his handling of the crisis, sought to level blame at the WHO. He accused it of failing to hold China responsible and of withholding early vital information.
Our countries are now experiencing, you look all over the world, tremendous death and economic devastation because those tasked with protecting us by being truthful and transparent failed to do so.
Dealing with a pandemic in the present makes looking back at past steps difficult. But as the death toll mounts, so do the calls for accountability. Who should have behaved differently and when? The WHO may owe the world some answers.
Now, we would have liked to talk to a WHO representative about this issue, but he canceled the interview on short notice. So we're grateful to be joined by Anna Holzschreiter, a senior researcher on governance for global health at the Berlin Social Science Center. Welcome to the program, Anna. We just saw in the report it took the WHO 1 month after it first learned about the virus in China to declare an international public health emergency. And it declared the outbreak a pandemic on March 11th. Was the organization too slow to act?
Well, I guess we are seeing accusations of inappropriate, slow or risky responses to the COVID-19 pandemic everywhere, not last with regard to how the US and the UK have been initially dealing with the outbreak. So why would we assume that an organization that's made up of 194 member states, that has virtually no sanctioning power, a very small budget and a huge mandate, is free of the power politics that surround this pandemic? The power politics that we can witness nationally and internationally. So the WHO is like all other international organizations depending on reliable information from its member states on contagious outbreaks of contagious diseases. And it's also heavily marked, of course, by so-called health diplomacy, that is, attempts by its most influential member states, and that includes the United States and China, to push through their specific interests, not only in times of crisis, but always.
So does that mean that the WHO did not get the proper data from the Chinese?
Well, it's always a very sensitive issue, particularly when we're talking about infectious diseases that have a potential to develop into a pandemic. We've already seen that during the SARS outbreaks in 2002, 2003. And it happens very rarely that international organizations that depend on their member states for financing, for support, openly criticize, particularly individual member states for their behavior. So it's what we are seeing as a kind of a typical behavior of an international organization. And I think it's also a rather bizarre and naive picture of international organizations that we assume they're somewhat beyond politics.
So the criticism that not only the US President Donald Trump has voiced regarding this behavior of the WHO, but has been echoed by other governments around the world, there's some merit to it.
Well, you're pushing me to make a specific argument. I would say, yes, the international organizations that are that large and that have that little autonomous power are very prone to reacting slowly. We've also seen that governments have reacted slowly, even though they may have they obviously have much more decision-making power. So it is undeniable that what we are seeing here in the context of the WHO, but also in the wider United Nations system, is a struggle between the United States and China over their authority in these organizations. And that includes, of course, also that we are seeing the Chinese trying to take advantage of the WHO in that situation, yes. Okay,
Anna, let's talk money. Let's talk financing. The US says it's freezing its share of the WHO funding, $116 million annually. How big a blow is this?
Well, I mean, it seems extraordinary because it's now all over the news, but it's also quite typical behavior for the United States in order to put pressure on international organizations. And it's also so now it's like this big threat of freezing the funds. It has done this before in the 1970s, for example, when the WHO moved to this Health for All agenda that you just mentioned in the teaser, and was accused of being a communist organization. But all countries in the world have very much reduced their regular budgets to the WHO, which means that it has really lost an autonomy over the past 2 decades, roughly.
And is that a problem, the losing of autonomy, financial autonomy?
Well, it is a problem. It's a problem because it gives the organization very little leeway in setting its own priorities. It makes it susceptible to powerful states that then push in and try to capture the organization. And it's also, it leaves a void that's very often then filled by, for example, private philanthropies like the Bill and Melinda Gates Foundation that are then beyond any kind of parliamentary or democratic control. So this is not typical to the WHO. We are seeing this everywhere in multilateral organizations at the moment.
Anna Holzschreiter of the Berlin Social Science Center. Thank you for speaking to DW.
Thank you.
Next up are your questions, the one about the coronavirus pandemic that you've been sending us. And the man to answer them is our science editor, Derek Williams.
Is mass testing for COVID-19 a better approach than only testing for severe cases?
It's grown increasingly clear as this pandemic progresses that the countries that took fast action have had the most success at keeping death rates down. And a key measure they implemented early on was testing as quickly and as widespread as possible. Because we still have no treatments, testing only severe cases at this point mostly only provides us with statistics like how many people COVID-19 has killed from among the total number of people who have tested positive for it. Widespread or mass testing, on the other hand, has the potential to be a powerful tool for prevention. If you're able to detect cases through testing before people even begin showing symptoms, you can limit their contact with others and really cut the number of other people they give it to. So mass testing is a goal that many countries are now setting, but of course it's also quite a tall order in terms of the resources that it'll swallow.
Is it true that 3 variants of the virus exist? And if so, how are they different?
Viruses evolve as they spread through populations, often quite quickly. That's what, for example, has kept us from developing an effective vaccine for HIV. It would actually be strange if SARS-CoV-2 wasn't changing, and there's evidence that it already has. A recent study led by researchers at Cambridge University identified 3 different variants of the disease in 160 patients, with one type most common in Asia and the other 2 mostly found in Europe and the US. The 3 types vary in terms of their genetic signatures. Armed with information like that, an important next step will be to determine whether those and possibly other variants affect different populations in different ways, and the data might even help us predict future global hotspots.
Are there any restrictions on sex? Will condoms prevent COVID-19 transmission?
With a significant percentage of the world's population stuck in forced intimacy at the moment, it's no surprise that this is a frequent question. Now, leaving the emotional and psychological aspects of lockdown aside, let's look at the science. First, condoms won't prevent the transmission of COVID-19. The evidence so far indicates the disease is not transmitted sexually. It's a respiratory condition that's passed along via droplets from the mouth and the nose. So if one of the partners is contagious, kissing is probably a more likely means of infection than intercourse would be. But according to the doctors I've read, if you live in a single household with your partner and minimal exposure to other possible sources of infection, there are no reasons to restrict your sexual activity, assuming, of course, that neither of you is having any COVID-19 symptoms. In fact, many experts encourage intimacy in those circumstances as a way to relieve anxiety and lower stress.